My name is Dr. Daniel Gomez. I'm an OBGYN and minimally invasive gynecologic surgeon here at OBGYN Specialist of Fort Lauderdale. I did my medical school in Puerto Rico and OBGYN training in Pennsylvania before relocating to Florida. Prior to this, I started my career as an attending when I was assistant professor at the University of South Florida in Tampa General Hospital prior to relocating to South Florida. I had the honor to serve previously as chief of OBGYN at Holy Cross Hospital for a few years. And made the move to private practice recently. I've worked with my current partners before in another capacity for many years. They're both excellent physicians and doctors overall, so the opportunity opened up to come closer to home. I live in Fort Lauderdale. I've lived here for almost 10 years, so this is my community. So that's how I ended up joining For Women Only, and it's been an awesome experience being able to be just closer to home and with people that I know. Not only do we offer the full spectrum of women's healthcare, which is outpatient office visits for well woman exams, pap smears, STD testing, office procedures, birth control, IUD placement. But my focus is on minimally invasive gynecologic surgery. So I do a lot of surgeries when it comes to benign gynecologic indications like management of fibroids, endometriosis, ovarian tumors, cysts. I'm the only one in Fort Lauderdale that is board certified in minimally invasive gynecologic surgery. And that's a designation that's given to the board of OBGYN to physicians that have demonstrated an efficiency and dexterity and performing minimally invasive gynecologic surgery. For example, laparoscopy, robotic surgery. If you need surgery for fibroids or hysterectomy, instead of making large incisions on the belly, what we do is we do the same surgery, but with minimal incisions. So you're talking about incisions less than a centimeter, less than the width of your thumb sometimes, or sometimes using a natural orifice. And the reason that's beneficial to our patients is because a lot of the times surgeries that used to be very invasive, requiring large stays in the hospital, can be achieved with a same-day surgery stay. For example, for hysterectomy, 99% of our patients go home the same day. Comfortable, pain is controlled. And by doing so, you really decrease the risk of complications from larger incisions, like, for example, infections, hernias, and long-standing pain and things of that nature. So the less invasive, the better. And the reason that's important for women in general is because the second most performed surgery in the United States is a hysterectomy. However, a lot of patients are not offered a minimally invasive laparoscopic or robotic approach to their surgery when they seek care for very common conditions like fibroids, endometriosis, pelvic pain. And so by offering this to our patients, we're really improving their outcomes and overall outcomes, and just it benefits them greatly. The OBGYN experience can be scary to our patients. And I think one of the things that we offer here, and not only me, but my partners, is that we treat you as a person. And that can be a little bit of a cliche phrase, but if you give us a chance, I think you're gonna really experience what that means firsthand. We believe you, we're gonna listen to you. We're gonna take the time that's necessary and not push you out of the office right away. Take all the time that's necessary to listen to what brings you in today. And that's the thing that really sets our practice apart from the rest, is that we're going to treat you like a human being, but also we're going to offer standard of care, evidence-based medicine that matches that, customer service and patient satisfaction that we're looking for as well.